Have you ever thought about what's happening inside your brain when a tumor starts to grow? A question that, quite frankly, most of us would rather not ponder on. But understanding the mysterious world of brain tumors is crucial for awareness and early detection. A brain tumor is an unwelcome intruder, a mass of abnormal cells that decide to set up shop in your brain. These cellular anomalies can be benign, meaning they're non-cancerous, or malignant, implying a cancerous growth. They're not as rare as you might think. Each year, around 80,000 individuals in the United States alone receive a brain tumor diagnosis. That's a small city's worth of people every year grappling with this life-altering condition. Now, imagine your brain as a city, with its intricate network of neurons and synapses, all enclosed within the rigid walls of your skull. A tumor is like an unplanned construction site that suddenly pops up, taking up valuable space. This leads to increased intracranial pressure, which is essentially a rising stress level within your brain's limited real estate. The brain, despite its impressive capabilities, isn't equipped to handle this kind of pressure. It reacts, it sends out distress signals, and these signals manifest as a myriad of symptoms. But what kind of symptoms are we talking about? What does this pressure do to your brain? Let's dive into the symptoms. Headaches are common, but a persistent headache might be a sign of something more serious. Yes, we're talking about brain tumors. A brain tumor can give you a headache that's unlike any other. It's not your typical migraine. It's persistent, relentless, and different. It doesn't just come and go, it stays, like an uninvited guest that refuses to leave. Now you might be thinking, what makes a brain tumor headache different from a migraine? Well, it's often accompanied by nausea and vomiting. These aren't your everyday headaches that you can just sleep off. They're a signal from your body, a cry for help. They're telling you that there's an abnormal growth of cells putting pressure on your brain. But remember, these symptoms can differ from person to person, depending on the specific location of the tumor in the brain. So if you experience a persistent headache, coupled with nausea and vomiting, it's crucial to seek medical attention. It might be a sign of something more serious than a simple migraine. But headaches aren't the only symptom. Let's dive into the world of seizures. Seizures can be terrifying, and they're a common symptom of brain tumors. Now, let's unravel the intricate world of seizures. Seizures, in essence, are disturbances in the electrical activity of the brain. They can be generalized or focal, each manifesting with a unique set of symptoms. Generalized seizures involve the whole brain, resulting in symptoms that affect the entire body. Ever seen someone suddenly lose consciousness, fall to the ground and start convulsing uncontrollably? That's a typical example of a generalized seizure. It's a scary sight, isn't it? But it's just the brain sending uncontrolled signals to the muscles, causing them to jerk and twitch. On the other hand, we have focal seizures, which only affect a particular area of the brain. The symptoms of focal seizures can be just as unsettling, but they're often less noticeable. Imagine this, you're having a conversation with someone and suddenly they start speaking gibberish, or they might just stop speaking altogether. Or perhaps they start seeing things that aren't there or experiencing strange sensations. These are some examples of what a focal seizure can look like. Seizures, whether generalized or focal, can be disorienting and frightening, not just for the person experiencing them, but also for those around them. However, it's important to remember that they're just a symptom, a sign that something is not right within the brain. They're the brain's SOS signal, a cry for help. While seizures can be a frightening symptom, there are others that can change a person's daily life in more subtle ways. So let's venture further into the complex world of brain tumors and discover these subtle changes as we continue to unravel the mystery of this debilitating disease. Imagine waking up and feeling like something about you has changed. That's a reality for many people diagnosed with brain tumors. The changes can be subtle, often overlooked, but they have a profound impact on one's daily life. Let's delve into the cognitive impairments first. A person may struggle with memory, find it challenging to concentrate, or have difficulty with problem solving. These changes can affect their work performance, their ability to maintain relationships, and their overall quality of life. Then there are the mood and personality changes. A usually jovial person might suddenly become withdrawn or irritable. Or perhaps a typically calm individual starts to display signs of anxiety or depression. These changes can be especially distressing, not only to the individual experiencing them, but also to their loved ones, who may feel like they're losing the person they once knew. Fatigue also plays a significant role. It's not just about feeling tired. It's a deep-seated exhaustion that can make even the simplest tasks seem monumentally challenging. This fatigue can be debilitating, leaving the person feeling frustrated and helpless. Finally, there can be changes in hearing and vision. A person might start to experience blurred or double vision. They might also notice a ringing in their ears or even a gradual loss of hearing. These changes can be disorienting and frightening, leading to a sense of isolation. These symptoms are not always immediately associated with brain tumors, often being attributed to stress or the normal process of aging. But they're important signs that shouldn't be ignored. They might be subtle, but they're significant. And recognizing them, understanding them, can make a world of difference. It's not just about diagnosing a brain tumor, it's about understanding the changes it brings and how it impacts the individual's life. These symptoms can be hard to spot, but understanding them can make a world of difference. Brain tumors aren't just an adult problem. They're the second most common type of childhood cancer. A sobering fact indeed, but one that underscores the importance of our discussion today. Just as in adults, brain tumors in children can manifest a plethora of symptoms, many of which are similar to those experienced by their older counterparts. In children, as in adults, persistent headaches, often different from the usual migraine and frequently accompanied by nausea and vomiting, can be a telltale sign of a brain tumor. These aren't your typical headaches that can be dismissed with a dose of paracetamol. They linger, they persist, often becoming more severe over time. Seizures too can be a symptom of a brain tumor in children. They can range from generalized seizures affecting the whole body to focal ones causing jerking movements, speech problems, and visual disturbances. It's a terrifying ordeal for a child and equally distressing for the parents witnessing their little one in such a state. But it's not just about the physical symptoms. Brain tumors can also trigger mood and personality changes in children, a shift that can be quite alarming for parents. Your previously cheerful child might become irritable or withdrawn. Fatigue can set in, making them unusually tired, and cognitive impairments can affect their ability to learn and process information. The symptoms can be subtle and often misleading, masquerading as common childhood ailments. But the key is to notice the persistence, the increase in severity, and the confluence of symptoms that don't seem to fit the usual pattern of childhood illnesses. Therefore, it is of paramount importance to seek medical attention if your child is experiencing severe symptoms, or if you notice a combination of these symptoms persisting over time. It's not about creating panic, it's about being informed, being vigilant, and taking action when necessary. Understanding these symptoms is crucial for early detection and treatment, because when it comes to brain tumors, every moment counts. And the earlier the detection, the better the chances for effective treatment and a hopeful prognosis. So, what does all this mean for you? Well, it's quite simple, yet profoundly significant. Understanding the symptoms of brain tumors is crucial for early detection and successful treatment. You see, the brain is the command center of your body, and any abnormality such as a tumor can disrupt its normal functioning. This disruption is reflected in the form of symptoms that we've been discussing. It's like a silent alarm that your body sets off, signaling that something isn't quite right. And when we understand these signals, we can act promptly, ensuring the best possible outcome. Now, you may be wondering, are all headaches a sign of a brain tumor? Not necessarily, but persistent and unusual headaches, especially when accompanied by other symptoms like nausea and seizures, could be a cause for concern and warrant a medical consultation. Another question that often surfaces is, can brain tumors lead to changes in personality or mood? Indeed, they can. Remember, the brain is responsible for our emotions, behavior, and cognition. So, a tumor can potentially alter these aspects, leading to noticeable changes in one's mood or personality. And what about children? Are they also susceptible to brain tumors? Yes, unfortunately they are. Brain tumors are the second most common type of childhood cancer, and the symptoms are similar to those in adults. This underlines the importance of being vigilant about any unusual changes in your child's behavior, physical health, or cognitive abilities. But remember, while it's essential to be informed, it's equally important not to panic. Not all symptoms necessarily indicate a brain tumor. They could be due to various other reasons. However, being armed with knowledge allows you to make informed decisions and seek timely medical advice. Knowledge is power, and understanding these symptoms can be the first step towards a successful treatment journey.